My name is Dr. Kate Anderson. I'm a non-Indigenous researcher. I'm based on Gubbi Gubbi land on the Sunshine Coast in Queensland, and I work with Tamara at UQ. Today, Tamara and I are going to be talking to you about a project we undertook for Cancer Australia to develop a set of key principles and best practices for conducting co-design with Aboriginal and Torres Strait Islander people.
My name is Dr. Tamara Butler. I'm a postdoctoral research fellow at the University of Queensland in the First Nations Cancer and Wellbeing Research Program, and I'm an Aboriginal woman from the Sunshine Coast region of Queensland, the Undumbi mob. It's really important that we acknowledge the country that we are recording this presentation on. So for me, that's the Yagara and Turrbal people here in Meanjin, Brisbane, and for Kate, that's the Gubbi Gubbi people of the Sunshine Coast region. We acknowledge elders past, present and emerging, and acknowledge that it always was and always will be Aboriginal land. Sovereignty was never ceded. So today we'll be presenting an overview of a project that our team was contracted by Cancer Australia to undertake late in 2021, and that was to develop a set of evidence-based principles and practices of co-design with First Nations people in Australia. It was contracted work, and it gave us the chance to develop what we hope will be some key guidelines for community, for policymakers, and for those involved in healthcare delivery to follow when it comes to working with First Nations peoples. They are applicable far beyond the cancer context. We'll briefly outline the importance of co-design, the aims of the project, a bit about our team, the project's First Nations governance and guidance structures, and then we'll spend a bit of time describing the methods that we used and the final set of principles and practices that we developed.
The term co-design suddenly appears to be everywhere, and there's a push for researchers, health policymakers and service delivery providers to be using co-design in their work. But what exactly is co-design, and when should it be used in health? In a nutshell, co-design in health is a shift in the approach of how solutions are found to complex issues or problems. It represents a movement away from professionals or decision makers finding solutions for people with lived experience towards an approach that finds solutions with people with lived experience. A co-design approach can be thought of as a method for including those people with lived experience of an issue or problem at the table to contribute to or lead the discussion around decision making about what's needed to overcome the problem and improve their situation in ways that are of value to them. How co-design is most appropriately used can really depend on many variables, but most importantly, it must meet the needs, preferences and expectations of those with lived experience who are being engaged. Australia, in their work to design a new lung cancer screening program, had recognised the importance of understanding the needs, preferences and expectations of First Nations people in order to co-design aspects of the lung cancer screening program that would effectively and appropriately deliver screening to First Nations communities. So this is what prompted them to employ our research team to identify a set of evidence-based and stakeholder-informed key principles and best practices for co-design with First Nations people, which would be applicable to the Australian cancer control context.
On this slide, you can see the investigator team for this project. Kate was supported by myself and Dr. Alana Gall on the day-to-day of the project. And we were also given very valuable senior guidance from Professor Gail Garvey and support for the project from Professor Marie Toombs. To ensure that our project had that strong First Nations governance and guidance over and above the role that Gail and Marie provided, we had First Nations groups supporting and providing feedback and guidance during this project. The first group you can see on the slide is the First Nations Co-Design Working Group, and this was put together for this project. This was comprised of 9 members, mostly working in research or health services, and we had a range of diverse gender, age and experience in that group. This group met 3 times during the project and at key time points to provide in-depth and detailed guidance on the methods and the findings of the projects. The second group there is the Cancer Australia Leadership Group on Aboriginal and Torres Strait Islander cancer control. This group provides strategic advice and guidance to Cancer Australia, a pre-existing group there. The leadership group's guidance ensured the project was conducted rigorously and that the findings would have broad applicability in the changing cancer screening landscape at the time of the project. They also provided valuable feedback and guidance during the project on the draft key principles and best practices. So for this project, we undertook 2 connected core activities. The first was a systematic literature review and synthesis of the findings to lead to a set of draft key principles and best practices. This then led into a second activity, which was a series of stakeholder consultations to get feedback on that draft principles and best practices. And through this process, it led to the final set of principles and practices. So just an overview of that first activity, the systematic literature review. Our systematic search of the grey and peer-reviewed literature revealed 99 articles. From these articles, we extracted a set of draft key principles and best practices, and these draft principles and practices served as the starting place for yarns using collaborative yarning methodology in the following activity.
From the findings of the literature review and to develop the final set of principles and related best practices, we used a collaborative yarning methodology. This is an iterative process of analysis that brings together multiple perspectives from different individuals and groups to review and discuss the findings and to collaboratively work towards a shared understanding of the results. The draft principles and practices from the review will then pass through our research team, the First Nations Co-Design Working Group, the Cancer Australia Aboriginal and Torres Strait Islander Leadership Group, and also yarning circles with 25 key stakeholders recruited from across the country. This process ultimately resulted in the final set of 6 principles and related best practices. Activity 2 of the project involved a series of stakeholder consultations to review the draft principles and practices that had emerged from the literature review. Stakeholders were identified and invited from these 3 groups: First Nations patients, carers and family, policy and experts, and cancer care providers, as well as researchers with co-design experience. We aimed to maximise the number of First Nations stakeholders across all 3 groups, but we did also include non-Indigenous people who had worked extensively in this space and whose views were deemed valuable to the project. The 25 stakeholders who participated joined one of our multiple online yarning circles. A handful of participants provided written feedback instead. Here on the slide, the breakdown of the 25 key stakeholders who were involved in the stakeholder yarns. We had a majority of First Nations people and a fairly even split across the stakeholder groups we targeted.
So after finishing up and conducting both Activity 1 and Activity 2, we identified these 6 key principles that you can see on this slide, and they are First Nations leadership, a culturally grounded approach, respect, benefit to community, inclusive partnerships, and transparency and evaluation. Of course, many of these things are interconnected and overlapping, so they shouldn't be thought of as siloed things, but rather interconnected kind of principles and concepts. What we'll do now is step you through each of these principles in a little bit more detail. However, as I'm sure you can guess, there is so much to explore in these principles. So at the end, we'll encourage you to do some homework and do some reading later on. We have a QR code for you to scan to get the full paper for the list of principles and best practices and the details of that process. This first principle is about having First Nations leadership embedded in the approach in a way that reflects the community's structure and interests. This leadership should be in place from the beginning to the completion of the project and direct all levels of the project, scaffolded by appropriate governance. Priorities for the project should be set by First Nations peoples. The culturally grounded approach principle means reflecting the strength and diversity of First Nations culture in the co-design project and approach. We are a small proportion of the population, but we're very diverse, so it pays to understand the local history of the people that you are working with. This principle foregrounds the use of strengths-based approaches, recognising the impacts of colonisation and racism and the need for social justice in the health space. This principle also calls on non-Indigenous researchers to strive for cultural competency and engage in self-reflection throughout the project. The principle of respect means recognising the expertise, experience and time of First Nations people and organisations. This includes payment for time and knowledge, and that adequate time and resources are planned for. Good co-design takes time. Approaches must incorporate flexibility and be familiar and engaging for First Nations people.
This principle is benefit to community. The principle states that co-design projects must aim to first serve First Nations peoples and communities above all else. It also emphasises that the project conception, design, processes and outcomes must provide timely, tangible and sustainable benefits that are valued by the community. This principle is inclusive partnerships. It states fostering and maintaining equitable and collaborative relationships between all participants is central in driving effective co-design projects. It also states that it's imperative to establish appropriate communication channels and conflict resolution processes formulated by and with the community in order to maintain trust and support authentic partnership. This is the principle of transparency and evaluation. This principle states that transparency in all aspects of the project is essential. Accountability to First Nations leaders must be formalised and embedded into co-design projects from the outset. Also, that embedding, monitoring and evaluation throughout the co-design process using agreed performance indicators facilitating transparency and accountability to community is essential. Cancer Australia is in the early stages of developing a toolkit to support the implementation of the principles and practices that we've outlined here. Tamara and I have been involved in providing strategic guidance on establishing this project to develop a toolkit. Publication of 2 peer-reviewed journal articles in a special edition of the International Journal of Environmental Research and Public Health are available via the QR code on the slide. We would like to thank Cancer Australia, Cancer Australia's Aboriginal and Torres Strait Islander Leadership Group, our First Nations Co-Design Working Group, all the stakeholders who participated in yarning circles, our senior First Nations researchers who provided us with guidance, and our research assistants.